Now we request Dr. V.K. Swamy, Dr. Venkatesh, please come. It's your session, sir. We would like to hear from you.
Yeah, good morning and good afternoon, everyone. Am I audible?
Loud and clear, sir.
Yeah,
Loud and
yes,
clear.
yes, yes.
Thank you so much. Please go
Yes.
ahead.
Yeah. Thank you, everyone. Mr. Dinesh Israni and also my dear friend, Dr. Sarath Das, for giving me this opportunity. And also I thank my organizations without which it would not be possible to be sitting in front of you. The OMILOCI, the Oral Maxillofacial Implantology, Laserology, Oncology Council of India, CAFO, Council of Accredited Forensic Odontologists, and COCTRACY, Council of Cosmetology, Trichology, Regenerative and Aesthetic Science of India, and ISDATHON, and last but not the least, Denversity, which is upskilling the dentists. So I'm taking this interesting topic today. It's in fact a burning topic. Everyone nowadays coming across this problem, airfall. Based on the airfall, we get into treatments. Normally, we consult dermatologists for getting treated medically. What if you want to transplant the hair from your same area, your own scalp, from backside to upside or sideways to the front side? So that technology is not yet developed worldwide also under some fixed curriculum. If you go to the hair transplant centers, basically we find these centers in beauty parlors or these salons, wherein they associate with the experts, technicians, doctors, surgeons. Nowadays, this problem is popping up because of the issue related to sterilization, infection control, technology, skill, latest advanced technology and all. So there are two techniques, FUE, FUT. FUE is just removing the hair follicles and transferring here and there. Through a qualified surgeon, if you are doing, it's a very simple job. But as we know, the infection is the source of all. So if it is done under the untrained hands, like technicians nowadays, very much into the link of the patients. So they mobilize the patient and do on their own. Maybe they may try to replicate the operation theater in their own salon. So they land in problem. So there is a medical dental dichotomy. I'm talking about my country, India, from 1948. So most of the time when we mention doctors, they include both medical doctors, surgeons, physicians, and dentists, according to their specialties. And there is another dichotomy is going on, that is medicine versus surgery dichotomy. For example, we in India call MD versus MS. For example, dermats, if you take it into account, they are medical specialists. They can diagnose the problem. They can give the solution through medications. They are least bothered about the procedures that they can recommend. And the plastic surgeons, they are all purely surgical base. They might have read medicine in their UG, MBBS. After that, they get into MS surgery and then they go to MCH, plastic surgery. And the dentists, you know, they are basically surgeons right from their UG, and they deal with head and neck anatomy very deeply, and they deal the scalp anatomy, physiology, pharmacology, biochemistry, microbiology, medicine, surgery, and other related fields in head and neck region. So now I want to discuss straight away, due to paucity of time, one case. It is a patient died in hair transplant surgery in Delhi. The patient name is Azhar Rashid. Age and sex is 35, male. So the cause of death is acute septic shock with Stevens-Johnson syndrome, as per Escorts Heart Institute and Research Center. So The news attracted me. Why? Because in our dental curriculum, there is a subject called oral pathology. So in oral pathology, deal with skin and pathological conditions. Chapter number 16, 17, there is very much elaborate description about these skin related disorders, pathologies. There they have mentioned with clear-cut description of Stevens-Johnson syndrome. So in this case, this was pricking to me. If this case has been handled by a dentist, the patient would not have been died, because they are day in day out, they are dealing with the infections, removing the tooth, while they implant the tooth, when they do root canal treatment, when they do gum surgery, when they do maxillofacial accidents, trauma cases, they time and again come across this Stevens-Johnson syndrome. And this is a matter of bad luck for the patient. He died. Why? Because he was operated by unqualified, you can say, by trained under some medical person. Of course, one cannot directly get into this type of procedure. So because of that, the patient died. And this medical legal case is related to the hospital did not talk about the procedures and furtherance of the death. They are talking about, in the cause of death, they talk about acute septic shock with Stevens-Johnson syndrome, but they are not too much probing into why this syndrome happened. Stevens-Johnson syndrome is nothing but a serious acute infection in the skin and leading to the death. So here they did not mention about the procedure already done in a unqualified place, that in a beauty salon. I will come later. Why? Because if they inform all this, then they have to go for the postmortem. They have to give more details to the police. So they might have done like this. This was the reply given by them in the High Court. So the background of the case is like it was coming into the public domain after the case was filed in a High Court, Article 226. You know, Article 226 is when Article 226 is concerned, the High Court is having more elaborate power than Supreme Court. Because in Article 32, you will have a very limited version. When your fundamental rights are being infringed, you will go to the court. But in a High Court, the Article 226, they have under, if you read with Section 482 CRPC, there was a mandamus writ filed against the United Hair Studio run by the technicians. And further, if you look into the FIR, it is 304 /34 IPC. 304 is the culpable homicide with not amounting to murder, and 34 is more than one person involved in the crime, maybe in a group of people. So 26, 27 Delhi Medical Council Act, all these matters filed in the court. So when the court looking into the matter, due to paucity of time, I will not go into deep. So who are all answerable? They come to this conclusion: the Ministry of Health and Family Welfare, Government of India, and State Government of India, National Capital Region, then the Police Commissioner of the city, and National Medical Commission. Of course, it was the rechristened version of earlier Medical Council of India. Then, of course, the Medical Council of Delhi State. So why Dental Council is not answerable? This is my question. You are listening to me. So dental people, the dentist turned cosmetologists or trichologists now in the country growing. So why the Dental Council, who is dealing with the dentists, not dragged into the picture? This is the main picture. If you Google hair transplant centers, there are dentists, former dentists today, they are the field dealing with trichology or hair transplant is nothing but the trichologists. We can call trichology. There is no special discipline as of now. Worldwide also you can take it. So why Dental Council of India not answerable? That is the reason this today's topic, we have to touch that angle. So the advisory given by the National Medical Commission on September 20th, talking about the guidelines based on the High Court judgment. In the High Court judgment, they actually forced the various, as I told, who are all answerable, in that they have asked the the National Medical Commission also get into the picture. So they are not elaborate in their advisory. For example, they are talking about a registered medical practitioner, RMP, and they are not talking the parallel people like registered dental practitioner, because a person going to a dental clinic, most of the hair transplant surgeons nowadays being trained in a fashioned way to deal with the hair transplant. So there are some flaws in the system that a lot of dentists, they are not, if you look into their patient dentist ratio, a lot of dentists are in the free mode. They are not having patients, or they don't know. This is called structural unemployment in India. There are 3 lakh dentists are there. You can see into the look into the joblessness. There are 1 lakh plus jobless people are there. So we cannot expect the people who are all expertised in head and neck region, they will not be included in the system. So formerly, the Medical Council of India, now the National Medical Commission should have some bridging mechanism to the large population called dental community. So there are pitfalls I will go into very fastly. There is no exclusion clause in the report. Means who should not do hair transplant, they are not mentioning, and they are also silent about the major players, dentists and cosmetologists and trichologists. And the guidelines are simply replica of court guideline. When you are being the regulator or you are being the medical council, you have to be giving your reasons, guidelines, advisory in a medical fashion. It should not be like legally court dictated, so you replicate it. It should not be like that. So that is one thing. And the inclusion of plastic surgeons and the repercussion is new in this advisory. It is not mentioned in the High Court judgment. So when you include plastic surgeons, could you really imagine what is the ratio between plastic surgeon and the patients? If every patient going to the plastic surgeon, it is not possible. And also the plastic surgeons are meant for some other important work. Disease oriented, somebody burnt their hand, they will do the plastic surgery, some serious emergency based condition. So you cannot expect a plastic surgeon to go and do the hair transplant. It is not possible. Again, you are motivating that same technicians. What the plastic surgeon will do, he will train a technician, and again the problem will arise. No plastic surgeon will sit for transferring the hair follicle to one place to another for 10 plus hours together. So this is indirectly you are appreciating that unqualified technicians. And secondly, there is no regulation for unqualified technicians in the country. So if the moment you start regulating, then the hospitals will stop functioning, because the majority of the staff in the hospitals run by the paramedic, and you cannot expect with a limited number of qualified people, you can run the health system in the country. And again, the ratio of patients versus dermats and plastic is not favorable. You cannot depend on them. And dermatologists, they are dealing with leprosy, psoriasis, and other skin-related disorders, autoimmune disorders. We cannot force them to come into this cosmetic and hair trichology. And secondly, mainly, the 7th point, if we look into the local anesthesia, dermatologists are not trained enough to look into. So local anesthesia, as far as local anesthesia is concerned, dentists are the number one choice, because they deal with the tooth. They remove the tooth. They implant the tooth. So they are playing with, literally speaking, with local anesthesia. So they know how to give the nerve block, let it be facial nerve block, lingual nerve block, inferior alveolar nerve block. So whatever infraorbital nerve block, all these nerve blocks are very much necessary in hair transplant, and they are the best experts to deal with. Secondly, then the medicine versus surgical dichotomy also not followed in this advisory, because dermatologists are basically from medicine side. They are not trained in such a way to deal with the surgical aspects. So there also it's the pitfall is confirmed. Again, regarding the instrumentation skills, if you compare dentists, dermats, plastics, dentists coming in the first choice, because they deal with the instruments, they deal with the hand skills, right from their UG, right from their first year, they deal with the instruments. So they have the skill. In fact, if you look into the dental chair, it is the advanced version of the dermat chair, because the chair will go up, down, and if in case patient feeling some syncope or septic shock, so they can deal very much. They can deal with sudden cardiac issues. They will deal with sudden bleeding issues. They can deal with any sudden emergencies, infections, acute problems. They will deal. So the dentists, they are the best choice. Secondly, the ground reality in the field is most of the dentists now training under someone and doing this hair transplant. Why don't we give them a concrete course structure? Why don't we form the curriculum, and why don't we include the UGC to frame a curriculum, and why don't we utilize the universities, why don't we motivate them to get into the doctors for their master's program in trichology? Because in India, there are very large number of seats vacancies there in the universities. So doctors should come forward. Apart from their clinicals, they should come forward the academic side, and they have to upskill in the emerging disciplines. Again, the ghost surgery concept. It is again we are motivating, like when plastic surgeon or dermats or a general surgeon associated with a clinic or a salon, they will try to be in absentia and appreciate the technicians to do the surgery. So this should be do away with. So for that, we have to appreciate the dentists to do the treatments, so that they will do on their own. And the intermediaries are very much powerful nowadays. They send the patients to the doctors, hospitals, clinics, salons for the commission. So that is also in India, there is no law to govern them. There may be some general laws, but in this particular emerging discipline, we have to keep this into account. And regarding the advertisements also, we can see in internet, Facebook, Instagram, there are a lot of ads, advertisements, air fall and air transplant. So that has to be taken into account. So in short, the curriculum is not followed in majority of the medical school. They have to include this curriculum in the UG itself, so that they need not go and upgrade themselves after the UG. And above all, the one thing is missing, which is surprising to me, is why don't we require a separate legislation in the parliament, like Medical Council of Act, Dental Council of Act, Bar Council of Act, like that. We have to have some separate act to deal with cosmetology and trichology. That till the moment our Council of Cosmetology, Trichology, Regenerative and Aesthetic Science of India, Coctracy, previously it was CCI.
I cannot see you. That's why I'm asking.
The guidelines can release the time to time guidelines. So the advisory is not following the level playing field for all the players in the market. They simply assumed that only dermats and plastics are doing. So rest of the people, it did not go into comment.
Yeah. आपको क्या LinkedIn का password चाहिए?
I reckon there's yeah, Dr. Venkatesh, probably your screen is frozen. Can you hear us? I think
he's got disconnected once again.
Yeah, I think so. So Professor Dinesh, so probably we'd wait for him to come back,
right,
so that he would come back, because we do have two more speakers.
Thank you, Dr. Sarath. I have come back already with alternative arrangements. So we were talking about the pitfalls. So let me continue with that. So UGC, the mother of all regulators, having lot of institutions, colleges, universities. So we have to get into the UGC back, because the Medical Council, Dental Council, Bar Council, all this council system, they are not fast enough to upgrade their syllabus. For example, we in dental schools, we read 10 years old syllabus. So there is enough freedom to the universities, which are all coming under UGC. So the academic council can get into the new courses, new syllabus, and we can entertain and educate the overflowing job force in medical and dental arena. So we can use them for the society. So based on that, we, the Coctracy, we have released the self-regulatory guidelines. And of course, we have taken into all the pitfalls. So with these guidelines, we can submit to the government, and also these guidelines will be benefiting the public at large. So the guidelines is nothing but connecting all the stakeholders in the fields of cosmetology, trichology, and regenerative science of India. Like cosmetology, trichology, we talked, and the regenerative and the stem cells are not yet allowed in India as a therapeutic methods. So that also can be taken into account. and the newly formed the Dentofacial Aestheticians, Cosmetologists, Trichologists, and India Association is dealing with those specialist dentists and trichologists, cosmetologists, how they can better serve the public. So this organization also into this regulating and self-regulating and advising the government and the various stakeholders in the industry. So there you might have understood the stress I am putting. So the tripartite struggle, dentists, dermats, plastics. So we can combine the workforce and deal the emerging discipline with care. Otherwise, what will happen? You deal with plastics, for example, it is very negligible amount if you count the number. So for the sake of very little number of plastic surgeons, if you develop the guidelines, you are omitting practitioners, large amount of practitioners, and we cannot burden the plastic surgeons to look into the hair-related ailments. Again, if you concentrate on dermats, then you are wasting your energy because they are not dealing the surgical procedures. They are basically meant for the medical management of the diseases, for the pathological condition. They can prescribe drug, or they can advise ointment, and they are the workforce to be handled to take care of leprosy, psoriasis, and other autoimmune disorders. We cannot tell them to take care of the hair. So the dentists, they are already taking care of the in instrumentation point of view. They are already dealing with the similar instruments. They are better way to handle the equipment used in the hair transplant. Also, they are already handling. They are skilled enough. They have this artistic surgical skills, and of course, they are all doctors, surgeons dealing with the infections. They know how to handle the OT, minor or major OT. They know how to do the surgical procedure in the chair. Dental chair is advanced version of derma chair, and also they are minute. Their hand skills are very minute to deal with tubules, like in case of root canal in the tooth. Similar way, they can deal with the hair transplant also. So this is the reality. The moment medical and dental councils sit together and try to make it out, then the society will be benefited, particularly in related to the hair transplant. Otherwise, what will happen? Now it is already happening. Dermats calling the dentist as quack, and dentist calling dermats as carpenter, or new people. And the plastics, they are saying you are not into my domain. Dentists are saying the region of upper jaw and lower jaw is our domain, and they are having plastics as intruders. So these things will keep on happening, and because of this, there will be litigations in the court for the medical legal cases. So this is what I tried to explain today, the which run through a practical case, a real case in the High Court. And with this, I think I didn't take too much of your time. I conclude and thanking the whole force today, the stalwarts and pioneers in the field of technology and the other field experts. Thank you. Thank you for it. Thanks for this opportunity. Also to my organizations.
Thank you so much, Dr. Venkatesh. It was a wonderful session. Actually, it was a great learning curve. Now the floor is open for any questions. If anyone has any questions to ask, so anyone, we're really open to answer questions here.
Yeah, thank you, Dinesh ji. So I think thanks for Venkat. He was in last year also in our conference. I welcome his conversation. It was great to see him again, but only a small question. You said like in the patient died about this Azhar Rashid. So after that, what is happening? Like it is something that you are now making the policy for the government, or because it's mostly private organization, they are doing those things, the plant transplantation or the dentist and everything. So do you have any recommendation from government, or what is the action at the moment government are taking in the worldwide or even India? Because there are a lot of things going on Turkey. So I know that a lot of people are actually heading to Turkey to hair transplantation and all sort of things. So regarding your conversation today is really great to awareness from many other organization and government to see what they can do in future. But do you have any recommendation, or do you see that government are taking any action at the moment? Just simple thing I want to know from you, if you have something, please.
See, regarding the government, we, the Indian government, is following a mixed economy, and we are not actually real sense socialist. Our socialistic form of governance is different from the word socialistic. So what happens? Government cannot look into the real-time professional procedures. They have to be left to the professional councils. Unfortunately, we have the medical dental dichotomy, as I told. Head and neck region, the dominant players are dentists, both in terms of their ability and their majority in numbers. And dental and medical council yeah, started persuading this new emerging discipline. The government job is pending till date. As I mentioned, the National Medical Commission coming with some advisory of 2-page advisory, which is creating more issues again than the clarity. The ambiguity is increasing now because they are not they have included the plastic surgeons suddenly. It is not possible. Plastic. If you say a lot of temples in India, they are transferring the head. It is also hair surgery. And if you tell the plastic surgeon to look into it, is possible. It's not possible. So that is why there should be a special separate legislation. Or you can take my point, like the government has to rely on the professional regulatory councils, whether it is government or private, because government cannot decide everything. For example, government should concentrate on printing notes, currency, external affairs, making atom bombs, all these big issues. Let the doctors, professionals deal with the thing because they are already facing a lot of problem with the quacks. So the stringent laws, complaining system, only way is a participatory democracy we follow. We have to give awareness to the public, and unnecessary harassment by the law enforcement agencies also creating all these menace. For example, in Coimbatore, the city in Tamil Nadu, Coimbatore, 5 dentists served a notice for treating cosmetology and trichology procedures unknowingly because dermats complaining them as quacks. And those dentists cannot explain because the society also calling you are a dentist, you do this. But being a dentist also, I'm saying, being a forensic odontologist dealing with the cause of death, mode of death, time of death in the court of law, I'm saying dentists are the first choice in dealing cosmetology and trichology. You can try with it. But dermatologists, after spending crores of rupees in their education, they find the dentists are doing a cakewalk. They are simply after their graduation getting to this upskilling, and they are getting into this, and they are thinking they are being a threat to their business. The dermats thinking dentists are threat to their business, and the plastics are really appreciable. They don't involve in all this. Only we are dragging them into the picture. So this is it, and we are looking for a new regulation, or there should be a separate committee, like both the players, major players, or bring all the major stakeholders into picture. Let us make a elaborate guidelines instead of 2-page document released by National Medical Commission. Get into larger guidelines. And the unfortunate thing, again, I am saying the Medical Council of India earlier we had, in fact, more productive according to me personally, because in National Medical Commission, I could not find who is the right person to talk. There are a lot of people, subcommittees, committees, so that the span of control is expanded. So we cannot point out, we cannot get something fruitful if in any case emergency, like we have talked in this particular case.
Thank you very much. I think that is a really great input, and this thing is actually we discussed I think in the conference, but I think elaborately it need to be aware by government and local authorities, and also there is a growing intention to do this type of thing, especially graduate. I think a lot of doctors actually graduating from unknown university. I mean, unknown means like in an unorganized, authorized government institution and abroad, and they came back and local population. I am sure India, Bangladesh, or in the third world and Asian countries and African as well. They are that much not aware of those inside. So I think government need to be little bit care about those proceeding and policy. So then few people at least save from this type of activities. But thank you very much to bring this thing, and thanks to sort of that.
Thank you.
Invite you. Thank you.